Hi, very good evening, all of you. Welcome to our 8th session, case-based discussions made easy. I hope you guys are all ready. So without any further delay, let's go ahead with our context-based, case-based discussion. So I hope everything is streaming fine. If there are any issues, please let me know in the comment section. Okay, yeah. Let's go ahead. Winter lethargy, yeah, we'll talk about that at the end of this session, Sidra. Right, Sidra. Okay, so here we go, case-based discussions made easy. So let's dissect them and let's enjoy the process of learning, right? So also you can find out these courses which are running currently at ptvdacademy.com. So here is today's case or context. An apprehensive mother brings her 8-year-old son to your clinic with the chief complaint of missing teeth in left and right posterior region of that child. She got to know about that missing tooth or teeth after observing her son's oral cavity and cross-checked it with or via Google search. Because it's 21st century we are in. Intraoral examination reveals partially erupted 3-6 and 4-6. And upon palpation, there is a hard swelling on buccal mucosa bilaterally. So this is the context you have. And here are some of the key areas which you can make a note of. And these hints or key areas are going to help you in establishing a diagnosis. Also, we'll look into the radiographic image. Without radiographic image, this question would remain incomplete. So before we move on to the next slide, I want you to carefully go through each and every word, of course, letters which are given in this particular slide. An apprehensive mother brings her 8-year-old son to a clinic with the chief complaint of missing teeth in both bilateral regions of lower jaw. And intraoral examination has revealed partially erupted 3-6 and 4-6. Maybe the cusps are visible, partially erupted. And upon palpation, there is hard swelling on buccal mucosa. Make a note of the age of the patient, make a note of the missing tooth or teeth, and make a note of the signs which you notice, that is hard swelling on buccal mucosa. Yeah, so here is the panoramic image. So what do you see? We said 8-year-old, so more or less the centrals, laterals are erupted, upper laterals are erupting. These are the areas which I want you to focus on. So this is the chief complaint with which the patient has come. I mean, the mother of the patient has brought the patient to a clinic with these chief complaints. Not completely erupted tooth, right? Patient assumes that the teeth are missing, but upon clinical examination, as an expert, you know that these are partially erupted. Only the cusp tips are visible intraorally. And this is the radiographic image, panoramic radiograph. So I've highlighted certain areas. I'm not going to describe them for you for now. I want you to observe and correlate this with the given context and then see like what could be the most probable diagnosis, right? I hope it's clear. And I reckon we can move ahead with our questions, right? So first question, What is the most probable diagnosis? And I promise you that I'm not going to reveal the key of last question as we have been doing for the past 2 sessions. It was by mistake, some technical issue which we rectified in this session. So no key is going to be leaked prior by mistake. So what is the most probable diagnosis? Yeah, mixed dentition, as Arshi rightly pointed out. So 8 years age, mixed dentition period after 6 years. So what is the most probable diagnosis? Is it nasopalatine duct cyst, buccal bifurcation cyst, dentigerous cyst, or periapical cyst? As you know, periapical cyst, usually you have that cystic appearance with corticated border, and it usually surrounds the periapical areas of the involved tooth. But patient has no pain, no symptoms whatsoever. The only thing is that the patient's mother noticed missing tooth. So you can obviously rule out periapical cyst, in my opinion. What about dentigerous cyst? If you had observed the radiographic image carefully, there is no radiolucency with the crown as an epicenter. Rather, the radiolucency seems to be encompassing the entire tooth. I hope you noticed all those things. Anyways, we'll go back to that slide once again, don't worry. What about nasopalatine duct cyst? It's usually seen as heart-shaped radiolucency between the centrals, maxillary centrals. Maybe you can rule it out as well. So the only option that's remaining is buccal bifurcation cyst. Do you think it could be buccal bifurcation cyst? Even I'm not sure, at least for now. Let's look into the slide once again. And before we look into this, let's look into the context once again. 8-year-old, missing teeth, missing first molars, right? Missing in the sense partially erupted first molars, missing according to the patient's mother, apprehensive mother. And also, they're talking about hard swelling on buccal mucosa bilaterally. That is, it's an indication of bony expansion, isn't it? So this is the panoramic radiograph which you have. So more or less, you can see the radiolucency engulfing the entire tooth, even involving the bifurcation area bilaterally, right? Dentigerous cyst, do you think it would engulf the entire tooth or the crown as such? In fact, in differential diagnosis of this lesion, that's how you can differentiate this specific lesion from a dentigerous cyst. We'll get back to that again in the form of equation. Okay, most of you say it's dentigerous cyst. Let's see. It's a case of buccal bifurcation cyst. Don't worry, even if you're wrong, we'll give you more information in the process and we'll make sure that you're not going to repeat the mistake. And we'll give you additional hints as well in the process because there are some clear-cut characteristic diagnostic features associated with buccal bifurcation cyst. Yeah, very good. Option B is right answer. So select few who have chosen option B, award yourself +4, well done. So the most striking, I'm sorry, I think I clicked it again twice. You can exclude it, don't worry. So the most striking diagnostic characteristic of a buccal bifurcation cyst, BBC, is option A, tipping of involved molar pushing root tips lingually and occlusal surface buccally. I'll not mind revealing the key because in this process, I'm going to give you some very important information along with a radiographic presentation. Okay, so what is the most striking diagnostic characteristic feature of BBC? We've gone through option A. Option B, on the periapical and panoramic films, the lesion may appear to be centered a little distal to furcation of involved tooth. Option C, delay in eruption of a mandibular first or second molar, as we have seen in this context, or do you think it's option D, all of the above? Very good, Smriti. Crown dashed at CEJ. Yeah, the cyst, dentigerous cyst, good. So all of these options are features of buccal bifurcation cyst, all of them. However, the most striking diagnostic characteristic of a BBC, even if majority of you find it tough to answer, you can make a note of it. Tilting or tipping of a molar. No other cyst does it, at least according to White and Pharoah. This is very, very important point. Do make a note of it. Even though BBC is relatively uncommon, if at all there is a question, this is definitely an important point, right? The most striking diagnostic feature or characteristic of a buccal bifurcation cyst is tipping of involved molar in such a way that the root tips lingually and the occlusal surface tips buccally, assuming that this is buccal side and that's the lingual side. Okay, so we can observe the occlusal radiographs carefully. Also, you can clearly see a bony expansion, smooth expansion of buccal cortical plate in illustration B, as well as in illustration C. And also the arrows which are being pointed out as given in White and Pharoah clearly indicate that the lingual aspect of the roots, in fact, the roots are tipping lingually because of tilting of the crown in such a way that the buccal or the occlusal surface tilts buccally and the root tips tilt lingually. You can clearly make out the root tips on the lingual aspect, right? So tilting of the crown, especially tilting of mandibular molar, is one of the striking characteristic feature of buccal bifurcation cyst. And also in the process, you have seen that there is smooth expansion of the cortical plate on the buccal side, right? Consider this point very, very important. And once you have this radiographic image in your mind, you're never ever going to forget the radiographic feature or the most important point associated with this buccal bifurcation cyst. Okay, tilting of molars. Now let's move on to the next question. Yeah, that's why we have a hard swelling, as Sidra rightly pointed out. So that was the basis on which we incorporated that keyword in this particular context. So last point you can see, last line, upon palpation, there is a hard swelling on buccal mucosa bilaterally, because buccal bifurcation cyst usually occurs bilaterally. Okay, so I'm glad you highlighted that point, Sidra. Well done. So first two questions, I know it's very challenging, but since I've given you the hint, since I've given you the clue, now that you know it's a buccal bifurcation cyst, I'm sure you'll be able to answer the rest of the questions, right? So let's see. Third question, true about buccal bifurcation cyst, I haven't revealed the key. Option A, the best diagnostic film is IOPA to diagnose buccal bifurcation cyst. Option B, it's most commonly located in association with mandibular second molar. Option C, it's associated with teeth which eventually become, or with teeth which are non-vital. Option D, none of the above. So which one do you think? Yes, is the true statement with regard to buccal bifurcation cyst? True about buccal bifurcation cyst. I'm sorry, there has been some intervention. So if anyone wants to promote any of your content, this is not the right platform, and please refrain from promoting your content here. You can do it elsewhere or on your own platforms. Please, let's carry on with our discussion, and please go ahead with active participation and engagement. Thank you. So what's true about buccal bifurcation cyst? Okay, so I think majority of you have been choosing option A. Danish has chosen option D. So first and foremost, the best diagnostic film is, see, we can go with panoramic image as we have seen initially, or we can go with an IOPA. But the best diagnostic film would be occlusal radiograph, which you have seen in the previous slide. In occlusal radiograph, you can observe the tilting of the molars. Also, you can observe the hard tissue swelling or expansion of bony cortical plate on buccal aspect. The best diagnostic film is thus an occlusal radiograph, mandibular occlusal radiograph, cross-sectional one. Option B, it's most commonly located in association with mandibular second molar. It's a false statement. It's most commonly located in association with first molar, mandibular first molar, followed by mandibular second molar. So even option B is false. Associated teeth are non-vital. No, it has nothing to do with the pulpal pathology. So pulp remains vital, pulp remains healthy as usual. So A, B, C are false. So true about buccal bifurcation cyst among the given options. Option D, none. None of them are true, right? All of the given statements are false. I hope it's clear. So option D is right answer. I think Danish, Priyanka, Sidra have chosen option D. The rest of you, don't worry. At least you learned from this particular slide. Whether you're right or wrong is secondary as long as you're oriented towards learning. That's how one progresses. That's how one improves. So option D is right answer. Well done. Now, penultimate question, buccal bifurcation cyst. Two statements. Statement one, buccal bifurcation cyst, if large enough, may displace and resorb the adjacent teeth. Statement two, if secondarily infected, periosteal new bone formation is seen on buccal cortex adjacent to involved tooth. Again, I'm trying to give you additional information in the form of questions. So even if you're wrong, it doesn't matter as long as you're learning, as I just mentioned. So option A, statement one is true, statement two is false. Option B, vice versa. Option C, both statements are true. Option D, both statements are false. So what's your opinion? What do you think? Which statement is right and which statement is wrong? Yes, there was occlusal radiograph shown. Also, there was panoramic radiograph shown, Danish. So why did you choose only occlusal radiograph? Okay. Anyways, well done. So which of the following statements is true or which of the following is false? Sidra is talking about marsupialization. We'll get back to the treatment aspect a bit later. Yes, we have several treatment strategies which can be employed to treat buccal bifurcation cyst. So which of the following options do you think is right answer? So I see majority of you are choosing the safe option, that is option C. Right. So both the statements are true. So buccal bifurcation cyst can displace the teeth, adjacent teeth, and also can resorb pressure related. And also if secondarily infected, there can be periosteal new bone formation on the buccal cortex adjacent to involved tooth, as you can clearly see in these particular cross sections of occlusal radiographs. So illustration A and B, you can see periosteal bone formation along the buccal aspect. You should be able to differentiate this image from the previous occlusal radiograph where there was no periosteal new bone formation, but here, once infected, there can be bone formation as mentioned in statement 2. So if secondarily infected, periosteal new bone formation is seen on buccal cortex adjacent to the involved tooth, as you can see in this cross-sectional occlusal radiographs. Observe these radiographs. Usually these images are underrated. These are taken for granted, but you can learn a great deal of information in a simplified manner and in an efficient manner through pictorial representation. So that's the reason why I'm presenting you these illustrations or radiographic images, which are from White and Pharoah. Make sure that you're observing them carefully. You can clearly see, right? Yeah, I hope you can see the cursor. If not, in illustration A, onto the left side of your screen, yeah, you can see increased radio opacity. In case of illustration B, onto the right side of the screen, you can see increased radio opacity, which indicates periosteal new bone formation. Yes, you can see the cursor, right, which is definitely a good sign. So I think I can point out. Very good. Right. So as you can see, we have been talking about this characteristic feature of buccal bifurcation is tilting the molar. So because of the tilt, you can see that the lingual cortical area being thinned out, and also you can see the roots very close to lingual cortical plate, right? Final question. I haven't revealed the key. So buccal bifurcation cysts in general are derived from which of the following options? Reduced enamel epithelium, epithelial cell rest and periodontal ligament, odontogenic epithelium, Exact origin is unknown. So which one do you think is more appropriate answer? I know this session is very challenging. It's very difficult. However, even if you're right, even if you're wrong, it doesn't matter. Observe the illustrations. Go through the given information. Once you if at all there is a question from buccal bifurcation cyst. Epithelial cell rest in PDL or endogenic epithelium, exact origin is unknown. So according to White and Pharoah, these derive from epithelial cell rest in periodontal ligament in the bifurcation area of the molars, the first molar. So option B is right answer. Also, we have a table which is from which has been extracted from Schaefer's. So you can see classification of odontogenic cysts. You can see various developmental and inflammatory cysts. These are based on the etiology, right? In fact, buccal bifurcation cysts also have been categorized by WHO as inflammatory cysts. And also you can see classification by tissue of origin, cysts derived from rest of malices, reduced enamel epithelium, dental lamina, unclassified, that is paradental and calcifying odontogenic cyst. And for your information, according to White and Pharoah, buccal bifurcation cyst, the synonym is paradental cyst. That is unclassified, as you can see in this particular table. Yeah, but according to WHO, buccal bifurcation cyst has been categorized as inflammatory cyst, right? So this is just an additional information for your reference. So if at all there is a question like all of the following cysts derived from dental lamina, except, you should be able to make out that exception, right? So thoroughly go through this table and make sure that you're familiar with names of all these cysts, and we have covered them in detail in your e-classes, oral path and medicine section. So the following are homework questions. I'm not going to ask you for your scores, don't worry. As I said, it doesn't matter how much you score as long as you're learning from each and every session or a question for that matter. What are the synonyms of BBC? I've given you one synonym now. So take it up as a hint and then see if you can get any additional synonyms. Because knowing synonyms is very important. What if I pose a question using a synonym rather than using the term buccal bifurcation cyst? Again, you should be able to identify the same. So what are the synonyms of a buccal bifurcation cyst? And what is the differential diagnosis of buccal bifurcation cyst? Previously, we mentioned something called as dentigerous cyst as one of the options. And in fact, it can be differentiated through radiographic appearance, through tilting, and what are other differential diagnoses? And how do you differentiate them from BBC? And finally, how do you manage buccal bifurcation cyst? Sidra, some of you have mentioned about, yes, some of you mentioned about marsupialization. See, previously, they even suggested extraction of first molar. But nowadays, see, first molar, anchor tooth, it's very much essential for growth of jaw. So extraction is contraindicated because through conservative approach, careful curettage, this cyst can be eliminated, right? And it doesn't recur, right? According to literature, according to White and Pharoah. But what are the different means through which you manage buccal bifurcation cyst? I wanted to refer White and Pharoah and get back with your key through mail so that we can address your queries or clarify your doubts through one-on-one text interaction. Right, so these are your homework questions. I hope it's clear. Right, so buccal bifurcation cysts, so this is something which I wanted to highlight in this session. In the process, I'm sure you had come across very, very important information exclusive to buccal bifurcation cyst. If you need any further assistance, you need any further clarification, feel free to get back through mail 24/7. Also, I see Sai Rajat posing a question. Sai Rajat, check out a doubt clarification form, get back through mail, and we'll clarify each and every doubt of yours, right? So any query you have from your side, see, it's not like we provide you ready-made answers. That never happens from our side. The objective of our session, one of the main objectives of PTBD Academy is to promote active learning. If I give you a ready-made answer, then you can simply replace me with a book or a guide. What's the point in doing it? What's the point in doing what I'm doing? I'm here to teach, but not to tell. There is a very major difference between the two. See, if I keep on telling, then all you will be doing is seeking passive information. Some students might assume that why don't you just tell us the answer so that we will mug up, but that's not how science works out. So you have any question, as a professional, you should understand that even in post-graduation for that matter, even in a professional career, if you have any doubt, you should put the effort to refer it actively, because only through referral from standard references, we'll be able to learn. And what's our role? Guidance. And that's what we have been doing for several years. So you have any query, you need any clarification regarding any topic, general or subject, doesn't matter. Feel free to get back through mail. If it is subject related, check out a doubt clarification form in general section of our e-classes via guest login and get back through mail, and all your doubts will be clarified accordingly. So those students who are already in touch through mail will understand what I'm trying to explain, right? So doubt clarification form is a wonderful format which we have been giving out for free. You can check out that format. Refer, analyze your doubt, and get back through mail for assistance from our side, right? I hope it's clear. And Sidra has been mentioning about, yes, Danish, you haven't read about this test? Maybe because it is uncommon. It's not that common. It's uncommon, usually seen in the first, identified in the first 2 decades. And I forgot to mention this. Actually, I wanted to start with this as a credit to the scientists who actually discovered it for the first time, somewhat, and another scientist name, Worth. Somewhat and Worth were the 2 scientists who first described it in the year 1983, right? So, I mean, hats off to all the researchers who have been relentlessly working, trying to identify these lesions and promote health in the process, right? That's what anyone's ultimate aim is all about, to improve the lifespan, to enhance the life as such through means of various latest tools, including science and technology, right? And also initially, Sidra has asked about how to manage winter allergy. I thought it was allergy, but when I looked into that carefully, it was lethargy. That's the reason why we say read every question, including every comment, not once but twice. You can overcome winter lethargy by burning out or by sweating out. In the sense, when I say burning out, not burning out psychologically, but burning out physically. Have you ever tried jogging for at least 20 minutes? I'm very confident that if I ask all of you to jog, I'm sure majority of you will not be able to jog for more than 10 to 15 minutes. How many of you can actually jog for more than 20 minutes? Even I couldn't previously, but for the past 1 month, I even started jogging. Now I can do it for 40 to 50 minutes, or even extend it to 60 minutes. So my point is, keep jogging physically, just try to sweat out. And that way, you will be bringing more life into your day. You will be more active, you will be more enthusiastic. But if you simply sit, simply open the book, no matter how the climate is, it can be hot, it can be cold. I can understand how winter can be, how harsh winter can be, but still try to work out at least 45 to 50 minutes a day. You can divide your workout into 2 sessions, 20 minutes in the morning session, 20 minutes in the evening session. All you need to do is just jog. You don't need any equipment, you don't need any costly shoes, nothing. Just jog for 20 minutes. Do it for at least 21 days. And then you will see, by then you can say winter might go, but whether winter comes or goes, whether summer comes or goes, you incorporate this jogging or any kind of sweating out activity for at least 40 minutes per day, you'll start experiencing the difference. And second thing, on beating lethargy, I would say diet plays a very crucial role. And regardless of the diet, whether it is vegetarian, non-vegetarian, salty, less salty, it doesn't matter. Any kind of food, when you take in moderation, there is a concept called 80%, filling your stomach to 80%, according to Ikigai. It's a Japanese philosophy. So what they say is, like, when you're eating something, so assume that this is your plate, even though this is a book, assume that this is a plate, right? You're trying to eat something. And when you feel like you're finished, but still you feel like eating, right? Just to satisfy, just for sake of satisfaction, it is at that point that you should stop eating. I mean, you cannot objectively measure 80% full of your stomach. So what they say is, whenever you eat something, if you're conscious enough when you're eating, I mean, not watching television or playing or doing something else and simultaneously eating, no, it doesn't work out that way. But when you're consciously eating, there is a point where you'll realize that the food which you're taking is sufficient, but still you keep on eating, like a dessert, like a side salad or a side dish, right? So those are the things which you can eliminate initially. So 80% concept. Or if you don't want all of this, just try to eat in moderation. Decrease the amount of food that you take. That will help you enormously in overcoming lethargy. And you might worry about nutrition value, but let me give you one classic example. We have two options, either eating food with more calories and less nutrition, such as ice creams, or more nutrition, less calories, such as fresh fruits or vegetables. So we have these two options. So the choice is ours. When you have options, the choice is ours. The majority of us would pick a food stuff which has more calories and less nutrition value. That's the reason why we keep building up fat in the process, right? When we are young, yes, it can be compensated, but when we grow, right, then it starts accumulating in various areas. So you want to choose food with more calories or more nutrition or anything of that sort is completely your choice. So that's another way of beating lethargy. So if you can address the physical exercise and diet on day-to-day basis, that itself will take care of majority of your ailments. I mean, you'll not have any ailments, first of all, and you'll lead a more active lifestyle in the process. Active lifestyle in the sense, your day becomes less and less lethargy. You feel like, you feel so, right? I hope you got my point. Yes, Ikigai, 80% true. So I'm not going to say eat, I'm not going to give you any prescription, right? I'm not going to say eat only foodstuffs like fresh fruits and vegetables that will break your diet. I mean, you can do it for 1 or 2 days, but later on you'll just break it and then we'll go full on trying to eat whatever we come across. No, eat whatever you want to, but keep this 80% rule in mind. It will definitely make a huge impact on your day-to-day life. Okay, Sidra, you're from UP. UP, yes, up. UP is also up, right? Also, Danish is from mountains. I've been to Kashmir, a wonderful place. Danish is a very lucky guy. Yeah, Sai Rajat. Yes, Sai Rajat, your post a query. Yeah, as I said, please get back through mail. We will clarify your doubt or query. Don't worry about that. Yes, Sidra. Danish, you're most welcome. Sidra, thank you. Appreciate your love and affection. Yes, I'm a hero. We're all heroes in our own lives, in our own lives. If you assume that it's a film, our life is like a film, and we are definitely a hero in that, without any doubt. Rohini, you're welcome. Salman, MDS oral and maxillofacial surgery from government college is good option. Are you asking me, Salman, or are you telling me? I didn't get your question. I mean, is that a question or is that a statement? Okay, guys, it was lovely interacting with you, and I'll see you tomorrow. Tomorrow will be our final case-based discussion live session for this week. I'll see you again tomorrow at 9:30 p.m. Indian Standard Time. So wish you all the best. Love you all. Get back through mail with your homework questions. We'll review and provide you key accordingly. Take care.